I'm Kim Graziano. I'm with the University of Oklahoma College of Dentistry, and I'm the Environmental Compliance Officer there, and I am the Infection Control Lead for OkMOM. We're going to talk today about exposures, what to do for needle stick exposures, and PPE and proper care of instruments. On exposures, we would like for you to, if you have an exposure, needle stick or instrument, any kind of sharps, wash the area immediately. You need to also notify the lead in your area. That lead will then get to me, the infection control lead, and I will take you and the source patient to the area that has been provided for testing. It is very important that you do not let the source patient leave. They are the most important part of the testing procedure. To get results back, the HIV test takes about 30 minutes. The HBV vaccine results are dependent upon the vaccination status of the source patient, and the HCV results are 3 to 5 days post-draw. Also, main thing is we want to prevent any needle sticks or sharps injuries, so use the CDC guidelines recommended for needle recapping, one-handed scoop technique. Be sure to use a mechanical device or a protector for recapping your needles, like the protector used from Crosstex. And that is also a one-handed scoop technique. Please be sure to always recap your needles. Do not leave them exposed on your procedure tray, so a potential for the assistant or your assistant to be exposed. Hand sanitizers are located around each procedure area. Use frequently. You need to be sure to use between each patient or gloving. And the most common mode of transmission of pathogens is by hand transmission. Now we're going to talk about the instruments. We will have a central processing area, which will be as centrally located as possible in the middle of the clinic. It is important to get the dirty instruments to the central processing area immediately. This will prevent two things. One, for the contaminants to dry on the instruments and creating a little bit more of a hazard for sterilization. And two, it will be a faster turnaround so we can treat more patients. Also, with your instruments, please do not take a large majority or hoard instruments, because this also prevents other practitioners from providing care. And then now we're going to talk finally about the PPE. OkMOM does provide gloves and masks and some overgowns. It is best that you bring your own eyewear. We do have some available, but they are disposable, so they're not as efficient as the ones that you would have. Thank you so much for volunteering at OkMOM. This is a wonderful community service. Thank you.